So when we look at asthma management, the long-term goals of asthma management are symptom control and reduction of risk. In order to control symptoms, we want to achieve good control of symptoms and maintain normal activity levels. With risk, we want to minimize future risks of exacerbations, fixed airway limitations, and the medication side effects. So in order to achieve these goals, we want to make sure that we ask the patient about their own goals regarding their asthma. This is very key because sometimes what we think of as a health professional should be a goal isn't always what is the top priority or goal for a patient with asthma. You may find that their goal might be slightly different than the goals that you're thinking of, and then you have to do some compromising in order to figure out what is going to be the best way to manage the patient. Sometimes it's addressing their goals first to gain that trust of the patient, and then later on incorporating those goals that you feel is most important. We need good communication strategies are essential, and we need to consider the healthcare system, medication availability, culture, personal preferences, and health literacy. And so it's always important if you're going to give them any type of printed information that it's at the appropriate level in the appropriate language, but you never just give a person medicine or you never just give a person a handout or a piece of information and think that that's education. Education needs to be done with the family and with the patient, and then you need to verify that the patient or family understand that education. And so oftentimes we'll use what we call a teach-back method. So we'll describe a concept related to asthma, and then we have the patient describe in their own words what that concept is. And this is vital, especially when we look at inhalers, to teach them proper use and then have them show you that they know how to use their inhaler. So teach and reinforce inhaler skills, adherence, and this is very key, especially if they're on a medication on a regular basis, because what we find is that over time, people sometimes think that their asthma is cured because they're not experiencing symptoms, but that's not necessarily the case. The reason they're not experiencing symptoms is because the medicine is controlling those symptoms. And so we have to make sure and educate at every opportunity to take that medication on a regular basis. Guidance on self-management, and this includes a written asthma action plan, encouraging self-monitoring, which is a big part of the asthma action plan, and regular medications review. And so again, with pharmacists being those medication experts, they are well positioned to be providing these regular medication reviews according to the GINA guidelines. And so especially when we look at inhaler skills, there's a nice little mnemonic here that talks about choose, check, correct, and confirm.